Hello everyone, I'm Mike Jones, and thank you for taking the time to learn more about our Advanced Medical Exercise Specialist Manual, or Advanced MES Manual. Now, you know our Advanced Medical Exercise Specialist course was a evolution from our Medical Exercise Specialist workshop that we've been doing since 1994. The AMES, or Advanced Medical Exercise Specialist, started as a residency. It's now evolved to a training series. And with that, the last component of that Advanced Medical Exercise Specialist is now a print version of the manual. So actually a hard copy of the manual. Now, here's my copy here. This manual is 1,200 plus pages. I've told you that before. It has protocols, assessment guidelines, sample documentation forms, medical exercise programs, and we also give you access to our resource library that has videos showing you step-by-step procedures for assessment of range of motion and strength, and also functional capabilities. So this all comes as part of the manual. You can see this manual is huge. Well, I want to tell you a little bit more about some of the components we have in the manual. Now, we've identified the essential MET protocols, guidelines, and skills that every medical exercise professional must be proficient in. With that, we also, in this manual, give you the foundational components you need to now go out and provide excellent and top-notch medical exercise services to produce positive functional outcomes for your clients. Notice the word function. Function is the key to what you do as a medical exercise professional. And let me say this right here. Medical exercise training was never designed to take the place of the physical therapist, the occupational therapist, nor the chiropractor. It was to augment those services. And when we started to see in the 1990s that insurance carriers were cutting back on reimbursement for PT, we took it upon ourselves as physical therapists to now train fitness professionals to fill that gap or bridge that gap. Now, folks, 30 years later, that gap is getting bigger because insurance carriers are cutting back more, and you, the medical exercise or fitness professional, is working with a more challenging client. That's why we put this manual together. Your job is to improve their level of function. So we have a section in the manual where we talk about the components of function and how exercise enhances those components of function. We also have a section in the manual where we talk about your role as a medical exercise professional. This becomes important, folks, because you have to stay in your lane. You have to understand what everyone else is doing in that healthcare and wellness team to understand where you fit in. And it's most important that you understand what your scope of practice is. We go over that extensively. Now, we talked about function and your role. Your role is to improve the client's level of function after they've been discharged from physical therapy or occupational therapy. It's not to compete with the therapist, but to augment their services with exercise. That's the most important component. So we have a section where we talk extensively about functional outcome measures, what we call FOMs. These are indicators of MET success in that these are values. You can see here we have blood pressure, we have blood glucose levels, we have cholesterol levels, we have range of motion, we have muscle strength testing. These are all indicators that the exercise program is working for your client, and the client is exhibiting higher levels of function. That now validates everything you're doing as a medical exercise professional, and we give you all these guidelines in the AMES manual. We also give you strength testing procedures and a scale. Now, this is the functional muscle strength scale. We give you also the traditional scale, and we give you step-by-step videos that show you how to test muscle strength properly so you can now communicate better with the doctors, the therapists, and the chiropractors. And most importantly, report your strength gains more specifically and more professionally. Along with that, we also go over things such as the pain scale. These are also part of our FOMs. So you can now understand how pain should be measured rather than just being something that is nebulous, but we can actually come up with point values for it. That will show clients improvement. Along with that, we go into things such as the gait cycle, explaining to you the phases of gait. So instead of just kind of looking at gait and kind of having this blurred idea, we now start talking about the specifics with gait. And we even have we go over the common deviations that you'll see so that you have a better understanding of what the therapist, the chiropractor, and the physician are seeing, so you can better help with exercise to minimize those deviations. This becomes important. And I think probably one of the biggest things we put together, we worked on this for years, are the assessment and exercise management grids. Based on various conditions, we'll tell you what exercises the client can do that are acceptable for that condition, that may be contraindicated for that condition, and maybe even give you some range of motion and resistance guidelines that'll help you better able manage your clients. Because we know a lot of this with the medically based client for some of you is guesswork. We take all the guesswork away with this AMES manual. So with that, please remember, this manual is 1,200 plus pages at this point. We will update the manual as we go along. And I've talked about the protocols and the assessment guidelines and the sample forms and all the other stuff. But biggest thing now is normally the manual sells for $225. We're putting it on sale now for $197. Now, it's a gargantuan manual. We ship it U.S. priority mail. It's $24 for the shipping. So please, if you would, go over to amesmanual.com and order yours now. We just received our first shipment of 40 manuals. We've discounted the price to $197. You'll still pay the shipping. And please, if you would, order now before the prices go back up. So with that, have a great weekend. Thank you for watching, and best wishes building your medical exercise training practice. I think this AMES manual will help you. Take care.